I need to sit down. It's my baby. This is my daughter. She was 13 weeks, 3 days here.
Many states had trigger bans that were in place. There were many places across the country where, on a Tuesday morning, women could access care and have an abortion, and then by Tuesday afternoon, the laws had completely changed. Patients suddenly had to travel hundreds of miles, many, many hours, to seek abortion care if they were pregnant and didn't want to be pregnant.
It was literally that same day where we announced to Derek's grandparents, and it was completely devastating. Basically, your water's gone. Your water is breaking, and there's nothing that they can do because my daughter still had her heartbeat and she was still moving. So at that point, I was not medically at risk, according to them. So I said, okay, so are you going to keep me and monitor me? And he said, we can't. So at that point, I was more confused, and then I started getting really angry, and I'm like, why? And then it hit me instantly. And I was like, is it because of Roe V Wade? And he said, yes. And I said, so if this would have happened 2 weeks ago, I would have been okay. And he said, we would have been able to induce you and terminate the pregnancy. I ended up losing 4 pints of blood, which is half of the blood in my body.
We are seeing delays in care, withholding of care, because of fear on behalf of healthcare providers and healthcare systems that if they intervene, their interventions may be misconstrued in a court of law as inconsistent with the narrow exceptions in the ban of that state. There's no other field where we, as a society and are asking for physicians to wait until patients are so sick, to wait until they are at imminent, threat of permanent disability or harm before we act. The analogy is, asking a trauma surgeon who is evaluating a patient who sustained a gunshot wound. Well, let's wait until they've really lost a lot of blood before you transfuse that patient or before you operate.
What happened to me is still not one of the exceptions. And it can happen again.
Our job is going to be completely doing a 180, which is, we've been preparing for that. We've been in constant communication with our sister affiliates in Illinois, North Carolina, Virginia, New York, all the states where we're going to have to be navigating our patients. It's scary to think, because you tell somebody that lives in Key West that the closest place that they can get abortion services is now going to maybe be North Carolina. That's a 24-hour drive, maybe.
So limiting the access to abortion doesn't mean that it just erases the need for abortion care. We know the ability to get safe and legal abortion in the U.S. is still determined by where you live and how much money you have.
In abortion restrictive states, if we're not providing care, we're also not training future healthcare providers. And so we're not training our future medical students and physicians and nurses and advanced practice clinicians the full spectrum of reproductive health care.
Roe v. Wade was just the floor for what abortion access should be. We always needed more. We will continue to work toward a future where our reproductive freedoms are no longer up for debate, and we are on the right side of history.